Some of the challenges that I see with the oncology pipeline today is we have a lot of Me Too drugs that are flowing through the pipeline. For example, our checkpoint inhibitors or just immuno-oncology in general, a lot of the drugs that are coming into the market or currently in the pipeline really target the same targets, the same receptors. And so there's really a need for innovation. I know that there is the tendency as humans to, continue to do what works. And I think we need to kind of step back and ask ourselves, we are able to provide a lot of new therapies for our patients that traditionally have been able to get them. But there's so many more patients out there, so many more cancer types that unfortunately have not received the same level of attention, from pediatrics to some of the tumors that, we have traditionally seen treatment resistance to. As we're innovating, cancer delivery is also getting more complicated. When we look at the need for extracting certain immunocells and then manufacturing them and then getting them back into the patient, multi-steps, lots of resources utilized, and really the need for a simplicity when it comes to medication delivery. We know that it is a tricky environment. We want to be able to find those receptors that are going to yield the benefit and get us to where we need to be, where hopefully cancer is more of a chronic condition, highly curable condition, and so that at the end of the day, we're really providing something of value to our patients. We have seen the cost of cancer therapies skyrocket. I think on average, new to market drugs are about $200,000 plus in annual costs alone, and we're talking about AWP. And so we really need to examine what can we do to curtail the cost, not just for payers, for patients as well, because at the end of the day, the right drug, right patient, and if you can get that patient a cure, then I think that's invaluable. However, we live in a world where things unfortunately have to be boiled down to dollars and cents. And the more cost, then of course, potentially the fewer patients that can actually receive these amazing drugs. So really need to think about cost and how much value it's bringing.